Thank you. I'm now joined by Mindy Lewis and Allison Farley from the Center for Prenatal Pediatrics here at Geisinger Janet Weiss Children's Hospital. So, Mindy, let's start with, can you give us the basics of what the center is?
Yes, thanks for talking to us today. Imagine your loved one, your family member, your neighbor, maybe a friend, a sister, or maybe even yourself. You find out that you're pregnant, and the most exciting day of your life happens, and you're going to your ultrasound, and you're thinking, I'm going to learn today if it's a boy or a girl. And instead, what we tell you is that there is something wrong with your baby. Your baby's been diagnosed with a health concern that's going to require intensive pediatric follow-up after birth. And the Center for Prenatal Pediatrics is really here to help support you through that experience. We're an interdisciplinary program that works with both maternal and pediatric specialists to make a care plan, to give you education, to give you support and care coordination from the time that diagnosis is made throughout the duration of your pregnancy, as well as during the time that your baby may require neonatal care here at the Janet Weiss Children's Hospital.
So, can you talk a little bit about how you bring in people from different departments to kind of work together to determine a game plan?
Sure. So if your baby is diagnosed with a surgical need, then we would add the surgeon to our already core team. And our core team comprises of a neonatologist, a maternal fetal medicine specialist, or a high-risk pregnancy doctor. We have a nurse specialist from labor and delivery, a chaplain, and Allison and I are both trained as social workers, so we add to that component as well.
And how long have you had this center here?
The center has been here since 1996. No, I'm sorry. The center's been here since 2006. And we've been going strong since then, slowly growing and adding to the hours of service that we've provided to patients and families.
And now you get funding from Children's Miracle Network, correct?
We do. So the Children's Miracle Network has been very instrumental in the growth of our program. They actually funded me back several years ago when I first started in this position. They funded one of our chaplains that provides direct service to our patients. And most currently, they're funding Allison's position. And she's recently started with us, so we're very happy to continue with funding opportunities through Children's Miracle Network.
So, Allison, can you tell us a little bit about what you do here at the center?
So, like Minnie said, once the patient has the fetal diagnosis, we kind of get involved with patient education, helping them understand what is going on, care coordination, because they have all those appointments with different subspecialties, and then emotional support, because it's not what you expect or want when signing up to become pregnant. So we just kind of help walk them through their time being pregnant, and then help hook them up with whatever subspecialty they'll need afterwards.
And so for someone who is a soon-to-be mom, what do you think it means to them to have this team of people that are there and ready to help?
I like to think that we can try and lessen their burden, lessen some of that anxiety of knowing when the appointments are, what to get scheduled, where to go, what is it exactly that they're dealing with, try and make it easier for them as possible. So I think I try and just kind of take the, what can I do to lessen their load over all of this, so.
I think maybe I can add a little bit to that as well. So our patient's experience is really not cookie cuttered. It's very individualized. And so we're going to build a care plan that's specific to your need. And that is from as simple as, providing you the education and the support to as complex as making a medical treatment plan for both you and your baby. And what's really unique about the Center for Prenatal Pediatrics, as you're looking at other fetal care programs, is that we provide what we like to call as a one-stop shop. And meaning when you come and you meet with our interdisciplinary team, you're meeting with all of those people. So you could have multiple surgeons, the pregnancy doctors, the neonatologists, cardiologists, all at the table at one time and in one place with the family present, so that they can understand that we struggle as a team too. We see them as individuals. Their baby matters to us. They can ask questions of all of us and understand how one piece fits with another piece, as well as participate in making a plan. It gives them a little bit of power and control back, and it's an otherwise very powerless circumstance.
That's really special what you're able to provide for those families. And so now, the funding that comes from Children's Miracle Network, that you were saying it funds your positions, but is it only for a period of time? How does that work?
Yeah, so typically it's funded for a period of time. It can be 1 to a couple years from there, and then those funds get operationalized in the hospital different funding units as appropriate thereafter.
Okay. So how are you hoping to see the center grow in the future?
Well, if I had my wish, I would like to have our own independent clinic. Right now we're a virtual program, and so we kind of move and go with where the patient goes, so we're seeing them in amidst other clinics that are already established here. And I would like a patient to be able to come and, enter a doorway and enter the Center for Prenatal Pediatrics, where it's all staff, funded and supporting and providing only care to our fetal care patients.
Mindy, Allison, thank you so much for what you do and for sharing here with all of us today. So that's, for now, we'll send it back to you.